2 eggs. That is all it took for one of my patients, 68 years old, 12 years of type 2 diabetes, to drop her fasting blood sugar from 174 to 128 in 3 weeks, without changing a single medication, without buying anything expensive, without joining any program. She had been eating eggs the whole time, for years, and they were not helping her. Something she was doing around those eggs, small decision she made every single morning without thinking twice, was silently canceling every benefit those eggs should have been giving her. In this video, I'm going to show you exactly what those mistakes are. And I promise you, when I name them, you will recognize yourself in at least one, probably two. I am also going to explain something that most doctors never have time to cover in a regular appointment. A hormonal event that happens inside your body every single night while you are completely asleep between 3 in the morning and 7 in the morning that is directly deciding what number you see on your glucometer when you wake up. Not your dinner, not your medication. Something happening while you sleep. And near the end of this video, I'm going to share one dinner time change, just one, that my patients tell me drops their fasting morning number by 15 to 25 points within 2 to 3 weeks. Most of them describe it as the first time in years that the morning number actually moved. Stay with me. Everything I'm about to share starts working tomorrow morning. I'm Dr. James. I am a practicing physician, and I see diabetic patients every week. What I am about to share is exactly what I tell them. Before I get into the mistakes in the protocol, you need one simple piece of biology. Without it, nothing else I say today will fully make sense. When you have type 2 diabetes, the core problem is not usually that your body stopped making insulin. Most people with type 2 still produce insulin. Some produce more than a healthy amount. The deeper problem is that the cells in your muscles and your liver have stopped responding properly to insulin's signal. Imagine your body is sending a very clear message: open up, absorb this glucose. But your cells have turned the volume all the way down. They can hear something, but they are not acting on it. That is insulin resistance. Now here is where eggs become important. 2 large whole eggs contain around 12 to 13 grams of complete protein. Complete means it has every single amino acid your body needs and cannot make on its own. When that protein arrives in your stomach, it does something remarkable. It slows down how quickly food moves from your stomach into your small intestine, the place where sugar gets absorbed into your blood. Instead of sugar rushing in like water through an open faucet all at once, it trickles in slowly, at a pace your body can actually manage. Think of it this way. Imagine 2 glasses of water. You pour a full cup of sugar into both of them. In the first glass, you pour it all at once. It hits the bottom in one dense cloud. In the second glass, you pour it in a slow trickle over 5 minutes. It dissolves gradually, never overwhelming the water. Same sugar, completely different impact. That is the difference between a breakfast with no protein and a breakfast anchored in eggs. And here is what makes eggs truly special for someone managing blood sugar. Their glycemic index, meaning how fast they turn into sugar in your blood, is 0. Eggs by themselves do not raise your blood sugar by a single point. They contribute protein and natural fat. Neither one directly raises glucose. So the egg contributes nothing harmful to your blood sugar while actively slowing down everything else you eat alongside it. That is a remarkable combination in one food that costs less than 30 cents. Now before we go any further, I want to address the cholesterol question. Because I know many of you stopped eating eggs years ago because a doctor told you the cholesterol was dangerous for your heart. You switched to oatmeal and fruit. You thought you were making the safer choice. And I want to set the record straight right now before anything else. Here is what the current science actually tells us. For the vast majority of adults, the cholesterol you eat in food has very little effect on the cholesterol level in your blood. Your liver produces cholesterol constantly, and it self-adjusts when you eat more through food. The real drivers of dangerous cholesterol are refined carbohydrates, added sugars, and processed fats, not eggs. Research published in respected medical journals shows that whole egg consumption raises HDL, your protective, good cholesterol, and improves your overall cholesterol picture. A study published in 2025 found that people eating 2 eggs a day as part of a balanced diet actually saw their harmful cholesterol decrease. What that means in plain terms is this: the food you gave up to protect your cholesterol may have been your friend all along. And what you replaced it with, the oatmeal, the juice, the toast, was spiking your blood sugar every single morning without you realizing it. You were protecting one number while quietly making a more dangerous one worse every single day. Now let me tell you about Helen. Helen is 68 years old. She came to see me 14 months ago, carrying 12 years of type 2 diabetes and a look on her face I have seen many times. Not panic. Exhaustion. The exhaustion of someone who has been genuinely trying for a long time and not getting the results the effort deserves. She handed me her glucometer log without me asking. Fasting blood sugar every morning, 165 to 180. Her A1C, the 3-month blood sugar average, was 8.3%. And then she said something that stopped me. She said, "Dr. James, I eat eggs every morning. I thought I was doing everything right." So I asked her to walk me through exactly what she did. She woke up, fried 2 eggs in olive oil, healthy fat, she told me, and ate them alongside 2 slices of whole wheat toast and a small glass of orange juice. No added sugar. She genuinely believed this was a responsible, careful breakfast. Here is what that breakfast actually looked like inside her bloodstream. The orange juice, even fresh squeezed, even with 0 grams of added sugar, hit her blood as liquid glucose within 15 minutes of drinking it. There is no fiber left in juice, nothing to slow it down. It enters your blood almost as fast as drinking sugar water. The whole wheat toast, and I will explain in a moment why whole wheat bread is often not what the label suggests, added another 30 to 35 grams of rapidly absorbed carbohydrate on top of that. The olive oil she cooked the eggs in, and this surprises most people, added a fat load that temporarily made her cells even less responsive to insulin. Her post-breakfast blood sugar was regularly hitting 220. The egg was doing its job perfectly. Everything surrounding it was working against her. I made 2 specific changes, just 2. Her medication stayed identical. Her walks stayed identical. 3 weeks later, Helen's fasting blood sugar was 128. Her reading after breakfast dropped to 141. After 4 months, her A1C came down from 8.3 to 7.4%. She came in for her 4-month appointment and told me, "I check my blood sugar now because I want to see the number. Before, I dreaded it." That is what correct preparation does. It does not change the egg. It removes everything that was working against it. Before I get to the mistakes, let me ask you something honestly. Does this sound familiar? You wake up, you eat what you believe is a reasonable breakfast, you check your blood sugar 90 minutes later, and the number is higher than you expected. You feel confused. You feel like you are trying and your body is not cooperating. If that is you, type yes in the comments right now, because what I'm about to show you is the direct explanation. But first, stop throwing away the yolk. I need to tell you one specific reason why, not 5 reasons, just one. Research shows that up to 48% of people with type 2 diabetes are low in magnesium, not slightly low. Clinically deficient, and magnesium is the nutrient your body uses to process insulin properly. Without enough of it, your insulin resistance gets measurably worse. Your insulin becomes less effective even if you are taking it correctly. Magnesium lives almost entirely in the yolk. When you throw the yolk away, you throw away the one thing that could help make your insulin work better. And beyond the magnesium, the yolk contains vitamin D, which improves how well your cells respond to insulin. It contains compounds that protect the back of your eye from diabetic damage. It contains B vitamins that protect your nerves from the tingling and numbness that so many diabetic patients develop over time. Almost everything clinically valuable in the egg lives in the yolk. 1 to 2 whole eggs per day. Eat the whole thing, every time. Now, I want to pause here for a moment because what comes next is the core of this video. The 4 preparation mistakes that cancel the egg's benefits entirely. The hormonal event happening in your body every night that controls your morning number. And the dinner strategy that changes it. If you have found this useful so far, this next section is where it gets very specific. I share clinical information like this every single week on this channel, the kind of detail there is not always time for in a regular appointment. Hit subscribe so you never miss one. Let's get into the 4 mistakes. Mistake number 1. Cooking eggs in oil or butter. I hear this constantly. But I use olive oil. Isn't that healthy? Olive oil is genuinely excellent. Cold on a salad, drizzled on vegetables. When you heat it to frying temperature, you are adding a fat load that makes your cells temporarily less responsive to insulin. You are blocking the very insulin pathway that eggs were supposed to protect. And the egg already contains its own natural fat. It does not need anything added to cook. The fix is simple. Scramble them in a good nonstick pan over medium heat with nothing added. 2 eggs cook beautifully in 2 to 3 minutes. Creamy, soft, no oil needed, or boil them. Hard-boiled eggs prepared on Sunday evening keep in your refrigerator for 5 full days. Peel 1 or 2 in the morning, pair them with your vegetables. Your entire breakfast is ready in 4 minutes. Mistake number 2, pairing eggs with refined carbohydrates, white toast, soft whole wheat bread, flour tortillas, sweet biscuits, orange juice. Here's a test I give every patient. Pick up your loaf of bread and squeeze it. If it compresses easily in your hand, it digests just as quickly in your stomach. That soft, fluffy whole wheat loaf is in most cases predominantly refined white flour with coloring added. The label says whole wheat. Your blood sugar does not know the difference. If you want bread alongside your eggs, find a dense, heavy loaf with visible seeds in it, one that does not compress when you squeeze it, and eat it after the eggs, not before. This matters more than most people realize. When protein arrives in your stomach first, it takes about 20 minutes to trigger the slowdown effect on digestion. If you eat the toast first, you have already started absorbing glucose before that protection is even in place. Protein first. Always. Mistake number 3. Adding processed meats, bacon, sausage, deli ham, processed cheese. These are labeled as protein. In reality, they are saturated fat, sodium, and chemical preservatives. The sodium raises blood pressure, which is already a concern for the majority of people with type 2 diabetes. The preservatives promote inflammation, and chronic inflammation directly makes insulin resistance worse over time. If you want something alongside your eggs beyond vegetables, smoked salmon, a tablespoon of fresh feta cheese, a small portion of cottage cheese, all are appropriate. All are genuinely satisfying. Mistake number 4, eating eggs too late in the morning. This connects directly to something I am about to explain. But hold that thought for one moment. First, which of those 4 mistakes were you making? Be honest with me in the comments. Type 1, 2, 3, or 4, or all of them. I see all 4 in my clinic every single week. There is no judgment here. There is just the knowledge of what to change starting tomorrow. Now, the hormonal event I promised you. It has a name. It is called the dawn phenomenon. And if you monitor your blood sugar, you have almost certainly experienced it without knowing what it was called. Here is what happens while you are sleeping. In the hours between roughly 3 in the morning and 7 in the morning, your body begins releasing a wave of hormones to prepare you for waking up. Think of it as your body's internal alarm system switching on before you even open your eyes. These hormones tell your liver to release stored glucose into your bloodstream. Your body is fueling itself for the day ahead. In a person without diabetes, this works quietly. The body produces a little extra insulin, processes the glucose, and you wake up with a normal number. But in a person with type 2 diabetes, that insulin response is impaired. The glucose enters your blood and and there is not enough effective insulin to process it cleanly. So you wake up with blood sugar that is already elevated before you have touched a single piece of food. This is why some of you check your blood sugar first thing in the morning and the number is higher than it was at midnight. Not because you ate something wrong, not because you failed at anything, because your liver was working all night and your insulin could not keep up. Now here's what almost nobody tells you about this. What you eat first thing in the morning either makes that hormonal glucose surge worse or it dampens it. A high carbohydrate breakfast, oatmeal, toast, juice, sweet cereal, lands on a bloodstream that already has the liver's overnight glucose sitting in it. You are adding 60 to 80 grams of rapidly absorbed carbohydrate on top of a system that is already overloaded. The blood sugar does not just rise, it compounds. It stacks on top of itself. And you are in trouble before 9 in the morning. A high-protein breakfast, eggs specifically, eaten within 45 to 60 minutes of waking, sends a completely different signal. It tells your body, we are fed, we are stable, stand down. Instead of compounding the glucose surge, the protein intercepts it and flattens it. And one more thing about timing that surprises many of my patients. Some people skip breakfast entirely thinking it will help their blood sugar. It does the opposite. When you skip breakfast, you leave that cortisol and glucagon window, that hormonal surge, running unchecked for 3 or 4 extra hours. Your liver keeps releasing glucose with nothing to slow it down. Your fasting number goes up, not down. Skipping breakfast with type 2 diabetes is one of the most common and most damaging habits I see. Eating eggs within 45 to 60 minutes of waking is not just about getting protein. It is about closing that hormonal window before it causes damage. Write this down. Eat within 45 to 60 minutes of waking. Protein first. Every single day. Now let me build you the exact plate that produces the best clinical results. Start with 2 whole eggs, scrambled without oil or boiled. This is your anchor. 0 impact on blood sugar, complete protein, full yolk included. Add half a medium avocado. The fat in avocado is the type that actually improves how well your cells respond to insulin, the complete opposite of what frying oil does. It also extends your window of stable blood sugar. Instead of feeling steady for 2 hours, you feel steady for 4 to 5. You arrive at lunchtime without the desperate hunger and intense carbohydrate cravings that happen when your blood sugar has crashed mid-morning. Add a generous portion of spinach. And remember what I told you about magnesium. 1 cup of cooked spinach provides nearly 40% of your daily requirement. This is not a small detail for someone managing type 2 diabetes. This directly improves how well your insulin works. Add tomatoes, mushrooms, peppers if you have them. All low in carbohydrates, all high in fiber, all gentle on blood sugar. That plate, eggs, avocado, leafy greens, has a combined effect on blood sugar that is close to 0. Patients who follow this consistently see their post-breakfast readings drop meaningfully within 2 weeks, not 2 months. 2 weeks. Eggs first. Bread last if you choose to have any at all. Now, the dinner strategy. Most people focus entirely on breakfast and daytime eating when they think about blood sugar control. But your fasting blood sugar in the morning, that first number on your glucometer, is not primarily determined by what you ate for breakfast yesterday. It is largely determined by what your liver did overnight. After a high carbohydrate dinner, pasta, white rice, bread, potatoes, your liver stores a large amount of glucose. During the night, as those dawn hormones begin to rise, the liver has an abundant supply to draw from. It releases significant glucose into your bloodstream while you sleep. You wake up with a high number, and you did not do anything wrong at breakfast. The damage was done 8 hours earlier at dinner. But when dinner is centered on protein and vegetables, specifically eggs, the liver has far less stored glucose to draw from overnight. The midnight release is smaller, the dawn hormone surge hits a leaner system, and you wake up to a noticeably lower number. In my practice, patients who shift to protein-focused dinners 3 to 4 nights per week consistently report fasting blood sugar reductions of 15 to 25 points within 2 to 3 weeks. A vegetable omelet for dinner. 2 whole eggs, non-stick pan, no oil, spinach, mushrooms, tomatoes, no bread alongside it, no rice. That is the whole meal. It takes 8 minutes to make. It is genuinely filling. And for many of my patients, it has been the single most impactful change they ever made. More impactful than any breakfast adjustment because it changes what your liver does while you sleep. Try it 3 nights this week. Measure your fasting blood sugar every morning when you wake up. Write the numbers down. Here is what to expect so you are not discouraged early. The first 2 days you may not see a dramatic change. That is normal. The third and fourth day is typically when the morning number starts to shift. By day 5 to 7, most patients are looking at their glucometer with genuine surprise. Give it the full week before you judge it. 2 important notes before I close. If you take metformin, eggs do not interfere with it in any way. You can make every change I described today with complete confidence. If you take injected insulin, please speak with your physician before changing your evening carbohydrates. Your dose may need adjusting. Do not manage that change without your care team. Everything in this video is clinically grounded and evidence-based, but it is general education, not personalized medical advice. Your history, your medications, and your body are unique. Always work with your own doctor. Here's what I want you to do. Just one thing. Try the dinner strategy 3 nights this week. A simple vegetable omelet instead of whatever carbohydrate you normally eat at dinner. Write your fasting blood sugar down every morning. Then come back to this video and tell me in the comments, what was your number before and what did it become? I read every single comment, not because I'm supposed to, because your result is exactly what tells me this work is genuinely reaching people who need it. If this gave you something real today, one thing you did not have before you clicked on it, share it with one person managing this disease. Just one person. That is all. I'm Dr. James. 3 nights this week. Come back and tell me your number.